Okay, such an outreach cases, they are good because it makes us to find people who are unable to reach the facilities due to other various reasons. Maybe they are afraid to come, maybe because of fear of the services which are being paid for, or maybe the facility is far from them, or maybe they just fear coming out to say their problems. So when we go to the people, at least we give them that opportunity to be treated in their own villages where they are easily reached. Yeah, and then those services are also free, so they are not afraid to come because they know that they will get free services and also free drugs.
We find that most of our teenagers have a lot of problem, and given that Uriri is one of the sub-counties with high teenage pregnancy, we as the ministry, we appreciate the turnout and the participation of the mothers who came to the clinic, because as it was towards December, and we know most of the children are now with the parents. When the children are coming to get services, like some are even asking for condoms, that means that sex is happening in the same cohort. And what we need to do as parents is to take care of these children when they are at home. Parents have a role to play in the management of this so-called teenage pregnancy. What also came out, if the parents can work hand in hand with the leaders of the community, other stakeholders like teachers, I think we are going to go a great way in reducing the teenage pregnancy.
These kind of initiatives strengthen the community health systems and re-trigger them so that they can be able to realize some of the gaps that they probably missed out in their routine targeting. And so I believe this is one of the best ways in terminally supporting community health management. Out of this, we were able to realize a lot, and there is already demand from Oruba and Got Uriri that we come in and try happen the same way that we happened in Sigira community. And so around February, we are already planning something that will give a difference in the community health systems around Oruba and Got Uriri.
So there's a lot of stigma in the whole thing that we need to talk to people and tell them that health is their business. And for them to do other businesses, health must be first. So it is important that we continue with such, and I want to ask the donors not to tire. They be with us, they frequent not only South Kanyamkago, but Migori County and Kenya in general, because we have so many cases of health issues that even the public themselves do not know. Some of the issues that we need to handle as leaders very promptly, as soon as possible, and I'm glad that there's a change in government that is headed by Dr. Chilayako, is the issue of drugs. Key, that was the main complaint, and most of the residents were opened up and they opened up and said that they are not willing to visit these dispensaries because one, they'll be tested and no treatment. Secondly, they are not seeing any service apart from the normal issues of visiting the hospital. So some of them have resolved to herbal medicine as an alternative. Some of them have decided to just use the other issues of painkillers and moving on, which is not a solution to the health issues. Mine as one of the legislators, we are going to work on it, on health issues. I'm glad I'm also in the health committee that is headed by Mheshimiwa Jojo Mamba, and we have to address health and allocate funds to health.